episode, I wanted to talk about my health challenges. I have Crohn's disease, which is a condition of the intestines. For years, I thought it might have been psychological. A lot of people said that it could have been my diet. I spent years of being depressed and feeling hopeless because the medications that I was being given really wasn't helping much. But I met my doctor, who has been my hero. With the procedures and the medications that he's given me, I have my active life back, and it feels fantastic.
Basically what Crohn's disease is it's an inflammatory disease of the intestinal system. It can occur anywhere along the digestive tract. Usually it will occur either in the small bowel or the colon. It's basically your body's own immune system sort of attacking itself, and it's attacking specifically the intestines. Nobody really knows for sure what the cause of Crohn's disease is, but the thought that there is probably a genetic predisposition to it, and it's something that is triggering it to occur. A lot of pain. It can lead to fevers, it can lead to bleeding of the intestines, it can lead to abscess formation, and it can lead to things like strictures and fistulas, which is like abnormal communications between the bowel and the abdominal cavity. There's no cure for it. The objective is to get the Crohn's disease or the inflammation into remission and try to keep it in remission. The first thing that I thought of, first time meeting you, was that your disease was already very, very far along. I remember thinking that it would have been nice if I had seen you 10 or 15 years before to be a little more aggressive with treatment.
So on a 1 to 10, how bad do you think mine started out?
Well, I think in general, I think yours is
remission.
probably about an 8.
Wow.
Once every 6 weeks, I have to go and get a IV medication for my Crohn's, which really has kept me having a normal, active life.
Usually it takes like 2 hours for my treatment, but it's amazing because I feel 100 times better after I get this medication. Fitness magazines, and I just hang out, so it's done. I'm kind of tired, but at least I started my blanket. Blanket is in the beginning stage, so I'll be done soon.
Today, we're actually going to go to my sigmoidoscopy, a day surgery that I have to get every month that Dr. Blank does for me.
Inside the hospital, me and my friend Chris are trying to sneak and take pictures. I have on my bracelet. I'm getting ready to go back and get changed for my sigmoidoscopy. I have on my beautiful gown, and I'm drinking coffee because I'm trying to raise my heart rate so that they'll give me more sedative, because it's actually very painful. I have very low blood pressure because I work out a lot, which is the positive thing about working out, but it's also the reason why they don't like to give you a lot of sedative, because what a sedative actually does, which makes you go to sleep, is lower your blood pressure. So I just finished having my sigmoidoscopy. I'm a little loopy because they give me Demerol. You see all this stuff going on over here? This is my Remicade from the beginning, and yeah, all I can think about doing right now is going home and going to sleep.
My ballet teacher, who's amazing, her name is Kat. She also has Crohn's disease, and she is probably the most popular ballet instructor in New York.
you been dancing?
I've been dancing 40 years. 42 years.
42 years. And how many years have you been teaching dance?
35 of those.
When did you find out that you had Crohn's disease?
On November 12th of 95, and I got a hamstring injury, and it made me very depressed, and I ended up in the hospital. I had some pneumonia and whatever. So that started it, and they didn't really find out till April that that's what it was. They had given me the wrong medicine, and I just went downhill. And then I ended up in 3 months in the hospital, Mount Sinai. Yeah,
Wow.
when they finally found out, trying to recover, doing a bout of steroids, and they wanted to remove my intestines, but I thought that would not be a good idea.
Maintaining a normal life can be hard sometimes. What in your diet and your lifestyle do you do to try to keep balance?
Well, luckily, my doctor was very strict, and I'm strict myself, but my doctor made me for 5 years not eat salads, anything with roughage, no colors. All I could have was white pasta, white potatoes, white bread, white for 5 years. But my doctor said if I did that for 5 years, it would calm down this, and then I would be able to gently eat things again. So after seeing her, when she gave me the okay, my husband and I ran to the local coffee shop and had a salad. It's the love of my life, crunching on salad.
Look at this woman. Can you please check her out? Kat, thank you so much.
You're
You're
very welcome.
awesome. I have to give it up to New York Park and Recreations. The Hudson River Parks are glorious. Me and my personal trainer here, Mr. 10-pound Yorkie Gucci, we love this park. Me and this dog run miles and miles along the water. I can't say enough how important it is for me to work out. And I just want to help other people to understand how important it is to take charge of your health. When I think back to how sick I used to be before Remicade infusions and Dr. Blank, I spent days in the fetal position. That was my life. This here, running on the West Side Highway, that was my dream. This is my dream. And now that I have my strength again, I want to shout it from the rooftops. Stop being couch potatoes and work it.
Give me a high five.
Yeah.
All right.